This is the presentation regarding the brain aneurysm and endovascular therapy. There are three basic questions regarding the brain aneurysm. What is an aneurysm, why they develop, and how they are treated. Brain is the master of all the kingdom and is protected in the bony skull and is supplied by 4 arteries in the neck. These are the 4 arteries in the neck that supply the brain. The 2 arteries on each side of the neck, right internal carotid artery, right vertebral artery, left internal carotid artery, left vertebral artery. These 4 arteries in the neck, they communicate with each other at the base of the brain. This is the base of the brain and this is the communication among each other. Here the brain is removed and we are seeing the base of the skull from the top, and one can see these 4 vessels, they anastomose with each other to form a circle, and this circle is known as circle of Willis. Circle of Willis provides a potential communication between the 2 sides of the brain, right side and the left side, as well as anterior circulation and the posterior circulation. This is internal carotid artery in the neck that enters the base of the skull through the foramina. This is the intracranial portion of the internal carotid artery that divides into middle cerebral artery and anterior cerebral artery, and this portion of the carotid artery is known as carotid siphon. Having understood the arteries of the brain, now we will come to the aneurysms. Aneurysms are balloon-like dilatation of the artery. These aneurysms are also known as berry aneurysm because they resemble the berry fruit like raspberry or strawberry. In this diagram, one can see the frequent location of the aneurysm. These aneurysms, they form at the curvature of the vessel where the direction of the blood flow change, or they form at the bifurcation at the branch point where the blood jet stream hit the arterial wall. So here the blood flow like this and it hit at this point or at this point, and they form at this location. This is the base of the skull and this is the circle of Willis, and one can see the frequent location of these berry aneurysms in relation to the skull bone. This is the anterior communicating artery aneurysm, this is the middle cerebral artery bifurcation aneurysm, and this is the basilar apex aneurysm. ACOM aneurysms are the most common location of the intracranial aneurysm, which form about 30 to 35%. Middle cerebral artery bifurcation aneurysm form about 20% of the intracranial aneurysm, and basilar apex aneurysm form about 5% of the intracranial aneurysms. These aneurysms are located between the brain and the skull bone in the space known as subarachnoid space. This is the skull bone. This is the dura mater, which is a fibrous lining inside the skull bone. This is the arachnoid membrane, and the space between the arachnoid membrane and the brain is filled with the fluid which is known as cerebrospinal fluid. So when these aneurysms they rupture in this space, and this is known as subarachnoid hemorrhage because they rupture in this subarachnoid space. Now we will come to the treatment of the brain aneurysms. Brain aneurysms are treated by 2 techniques, surgical and non-surgical, rather minimally invasive technique. Before we understand these treatment options, let us see this diagram and answer this question: how can we prevent rainwater collecting in the ground hole? So this is the large hole in the ground and we want to prevent the rainwater collecting in this ground hole. One method is by filling the hole by the concrete, and another method is by covering the hole by the concrete slab. So the first technique, to fill the hole by the concrete, is equivalent to endovascular treatment, where we place the soft coils within the aneurysm from the inside of the blood vessel. And the second method, to fill the ground hole by placing the slab over the opening of the ground, is equivalent to surgical clipping technique, where we place the clip at the neck of the aneurysm, and so that the blood is prevented going inside the aneurysm. These are the two leg arteries, abdominal aorta and arch of aorta, and this arch of aorta give rise to these four arteries in the neck that supply the brain. So the human vascular tree resembles the real tree in many aspects. So now we understood that the brain artery as well as the aneurysm in that artery is connected to the leg artery. This is the principle behind the endovascular treatment. In the endovascular treatment of the brain aneurysm, a small nick is made at the leg artery, and then a small catheter tube is placed across the abdominal aorta, across the neck vessel to the aneurysm. So one can imagine as if we are seeing the aneurysm from the inside of the aneurysm. Endovascular treatment. The endovascular treatment in its simplest form is a three-step procedure. The first step is catheterization, placing the catheter inside the aneurysm. Second step is coiling, where the soft coil is placed inside the aneurysm. And third step is finishing and detaching the coil and removing the catheter. However, we are aware that all these aneurysms are of various shapes and morphology. This is the narrow neck aneurysm, this is the wide neck aneurysm, and this aneurysm has no neck. This is fusiform aneurysm. In this case, one of the branch is arising from the aneurysm, and this is a complex shape aneurysm. This is the wide neck aneurysm. So the coil often herniate across the wide neck into the parent artery. So to avoid this coil loop to herniate across the wide neck, we often inflate the soft balloon across the neck of the aneurysm. So this balloon support these coils and will prevent this coil to herniate across the parent artery. It also help in dense packing of the coil. Another technique to treat this wide neck aneurysm is stent assisted coiling. The stent is placed across the neck of the aneurysm, and the catheter is taken across the stent and coiling is performed. This stent support this coil mass, prevent the coil herniation, as well as it also helps in healing of the aneurysm by facilitating the endothelialization of the aneurysmal neck. So the two main endovascular strategy is balloon assisted coiling and stent assisted coiling. So the endovascular treatment strategy depends on the location of these aneurysms as well as the morphology and the neck of these aneurysms. It can be only coiling, balloon assisted coiling, stent assisted coiling, or only stenting.